Coming up, Paris Hair and Beauty Supplies will be speaking with Dr. Joel Williams, owner of Soulful Cleanse. We're going to be speaking with him about dispelling the myths of colon cleansing and why he does what he do and how has it helped many people within the community. We will speak with him when we return after these messages.
I got so tired sitting deeply in silence about the atrocities of our hair. Put together business model and prayed that every customer receives full care. Packed our bags and said sell toward trend to build a store we didn't quite understand. 'Cause I love my people. If I had $1 billion right now, I'd build the biggest black.
We are back, folks, with Dr. Joel Williams here, from owner of Soulful Cleanse, based out in Delaware. Thank you so much, Joel, for joining us.
Yeah, it's my pleasure being here.
Wonderful. I think for most people, they're excited about you actually being here because we have a lot of folks who come in through Paris Hair Beauty Supplies and actually have found out how I've actually lost a lot of weight, working out, taking more of a plant-based diet, and they're asking me questions about, well, what is colon hydrotherapy?
Okay.
So I do want you to explain the difference between colon hydrotherapy and colonics.
Or colonoscopy.
Colonoscopy,
right.
Exactly, which most people get very mixed up between the two. So I do want you to tell the audience what's the difference.
Well, first, the first question is colon hydrotherapy, the benefits of it. When you talk about your gut and the intestines, it's important to know that you have approximately 21 feet in your intestines. You got 15 feet designated to the small intestines, and you have 6 designated to the large intestines. Now what happens is we eat food, goes into the stomach, then from the stomach it enters into the small intestines. Depending on the type of food we're eating, it will literally almost kind of smear through the small intestines, leaving a coating each time. The best way that we explain it is if at home we have our toilets, and if we use the bathroom and never clean that toilet, what happens after 3 months,
Residue.
4 months,
Yeah.
6 months?
Yeah.
A film will build up. So that's what happens with the colon over time. Now, how does that affect us? When you have that film on your colon is supposed to, especially the small intestines, helps absorb food.
Right.
It helps
Right.
break it down, extract out nutrients, all those good things. Now you get this film there, it slows that process down. That is metabolism.
Gotcha.
Some people think metabolism is energy. Metabolism is the process of breaking down food when you metabolize something into small little pieces so it can be utilized through the system.
Okay.
Now you have all these toxins in your colon. Things are now moving slow. Now you can't lose weight.
Right.
Now disease is able to stay around longer because you have these toxins.
Right.
So colon hydrotherapy is where water, certain temperature of water and a certain flow of water is entering into the intestines. And because of the temperature of it, it's not just breaking down fecal matter, it's also breaking down the mucoid plaque that is on the colon wall. And so as you begin to do these sessions, that's what happens. Now, I have clients too, they'll call up and they'll say, listen, I'm coming in for a colonoscopy.
Right.
That's a medical procedure. Colonoscopy is more structural. So they'll have you do a drink the day before.
Yeah.
They'll have you fast.
Yeah.
And they want you to come emptied out. And then you come in for your colonoscopy. They'll stick a camera in through the intestines and they're looking for polyps, structural damage. Whereas colon hydrotherapy is the actual process of getting in there, pulling out the waste matter, breaking down that mucoid plaque. So it's a big difference. And a lot of the success that we have at the office is because we look at the fecal matter.
Right.
That's where the information is. It's in the fecal matter. Now, the colonoscopy is getting rid of all the good information.
Right. What's very interesting is that I remember when I first started coming to the office and you mentioned to me, okay, listen, in order for this to actually work, I needed to come in to have the cleaning at least 3 times within 7 days. Why let the audience know, why is that necessary?
The length of the colon. That's a simple question. Once again, we're getting back to the length, where you're talking about 6-7 feet of the large intestines. Your first session, you're only getting the left side, which is called the descending colon. That's the part of the colon that goes down. Then you have your transverse. Your second session is a focus on the transverse, and your third session is a focus on the ascending colon.
Okay.
That's why we say 3 sessions. Now keep this in mind. This is for someone that moves their bowels every day.
Gotcha.
Now I have people come in who are septic. They literally move their bowels maybe once every 2 weeks, and they need a lot more than that, because we're actually doing a reconstruction of their colon. It's so bound and toxic and tied up. So
wow. And most of the time, I mean, we know the benefits. I wanted you to explain the benefits of colon hydrotherapy, because I know for me, folks, when I started my sessions, I was very bloated. I felt very bloated. I felt very uncomfortable. I didn't know where it was coming from. And although I was normal, and most people don't like talking about their bathroom journey, their poop,
right.
But it's so important. It's like us being born. It's just a natural thing
Right.
to do. And so for me, I remember when you said, hey, you may have parasites. I was like, what? I was like, what do you mean? I couldn't have parasites. Could that possibly also be the reason of slow bowel movements, is parasites? Because a lot of people feel like parasites don't exist in this country. It is only a third world country situation.
Right, yeah.
So that's one of the other myths. So I sort of want you to go into that as far as what your experience has been dealing with folks and them finding out that they do have parasites.
Right. Well, I mean, one thing, parasites, we all have them, and we need them. We really need parasites. So I want to say that clearly, because they're scavengers. So they eat little microorganisms in the colon while they're very important. Where they become a problem is where they get out of control.
Right.
And when you have a large population of them, fungus, which is yeast, and we need it. There's healthy versions of it, but we need it.
Right.
But what happens is when it gets out of control, the overgrowth of it, because parasites, fungus, they are alive and they feed off of sugar. They need it.
Did you guys
Now-
hear that? They feed off of sugar.
They need it. That's how they survive.
And
they
that's
will
how-
die without sugar.
And they multiply as a result of that.
They multiply as a result of it. So this is why when we have sugar, which we all have at one point in time had something sweet, large amount of it, or a large amount of carbohydrates, and we feel tired afterwards.
Right.
That's that whole process. I mean, you have so much going on inside your body trying to break down all these sugars. The parasites are going crazy, so your body is drained, and then you become tired. That's like the medical term of how we feel when we're sleepy after
Sure.
eating large amounts of carbohydrates and also sugars.
Yes.
They need them. If without sugar, parasites die. Now, I want to say this.
Okay.
We also need sugar. So this sugar-free kick that people are on,
Yeah.
you can really get sick, because there is, raised blood sugar levels, but
Yes.
there's also condition with low blood sugar level. But I'm sorry to digress, to answer
Yeah,
your
no,
question, with the benefits of the colon hydrotherapy is the same experience you have if you are constipated. If you feel like you have a stomach virus,
Okay.
you feel tired, you feel suppressed, it affects your mood. These are the things that come when the bowels are compacted. So the
Okay.
reverse of that is how you feel when you're emptied out.
Yes.
When the bowels are clean, you have energy.
Yes.
There's a feeling there. My study is deep into bacteria. I study bacteria.
Okay.
And so I'm very aware of what it does to us. It literally suppresses us. It suppresses us emotionally, spiritually, and physically.
Yes.
Bacteria is who we are. We have more bacteria in our body than we do cells.
Wow. Wow.
You can look that up. 80% of all the bacteria in your body is in your gut. So when we talk about why colon hydrotherapy is important,
Yes.
you're focusing on the gut.
So why is it that most doctors advise folks, okay, it's time to get a colonoscopy at 50, whereas I read in my studies that people are starting to get colon cancer in their late 20s and 30s. So why are doctors waiting so long to check this? At the age of 50, it could be too late.
Right.
Whereas you're suggesting that people should clean out their colon. Would that help prevent colon cancer, in your opinion, or lessen?
Yeah, of course. I mean, so you're talking about two totally different modalities of proper ways to heal. So healing, or what they call alternative health, and I always tell people, the medical field is alternative health. We're not alternative health. This is, we've been doing this for years. Grandparents, they've been cleansing. And so when a doctor comes in and says, I love alternative, no, you're alternative health.
Right.
That's not the way it's supposed to be done.
Right.
So the medical field works off of scientific data. They need data.
Okay.
And so by the time they get data, it has become a bad situation. Whereas we come from a different place of just sometimes what our spirit tells us to do. We're spirit-led with our health. Our ancestors used to cleanse and detox, especially in these other countries. I have so many different types of clients that come in, and they said, man, like seasonally, we knew as children it was time for us to cleanse and detox.
Yes.
We knew about castor oil packs. We knew about all these different things. So we kind of move differently than the medical field. They need data, they need science, so they spend millions and millions of dollars on all this research while people are out here dying.
Yeah, they do.
And we're a little bit different.
Yes.
So.
Yes. And which is great, because I mean, from my experience, when I was going through this, folks, the doctors would just easily just give you pills. That's one of the biggest problems. When I went to Dr. Joel, it was only because this woman who actually has products in our store, we call her Dr. Nigeria, huge shout out to her. She noticed that I was breaking out on my skin. And it was only because she says, you need to detox properly. Now, what did that mean? She suggested I go to someone to clean out my colon, which is how I found you. So I believe God works in mysterious ways, because, I could have gotten worse. I believe I would have gotten worse. In fact, I believe I would have gotten worse. And so I know it works for me. When does it not work for a person? I mean, because I hear people say, oh, it was the worst experience. You'll hear reviews and so forth. Why do you think folks are having bad experiences? Is it where they're going? Could it be that maybe their bodies?
I'm very, you've been many times to the place. We're very calculated with what we do there. I can't speak on other places, but we give you the pre-drink, that is the tri-salts with calcium, potassium, magnesium, and peppermint leaf, because we know that it lowers your acid levels.
Yes.
So we need your acid levels to be low before you get on the table.
Okay.
Afterwards, you get the tea with the fennel and the licorice to settle down your stomach. So if someone has a bad experience, has there been people that have come into my place and had a bad experience? Yes. Why? Because a lot of people, this is what it all comes down to. When you detox is tough.
It's uncomfortable.
It's uncomfortable. The real deal detox is uncomfortable. If a person is detoxing off of drugs, it's not a pretty day for them.
Absolutely not.
So what has happened is now we have people coming in, and they got their sunglasses on, their yoga pants. I'm detoxing. No, you're too happy. No, get out of here. You're not detoxing.
That's hilarious.
Detoxing, you feel it. So we've had people come into the office, detox, throw up on themselves.
Wow.
And then say it was a horrible experience.
Right.
Because a couple of friends had a reaction where they had energy or whatever. So but there's certain people who come in so toxic, so many toxins in their system, and when it's releasing, they feel it.
They feel it.
They feel it.
That's a very good. That's a very, very good point.
Next point is just like anything else. If you're working out at the gym, afterwards you have to hydrate yourself.
Yeah.
You need water.
Yeah, it's true.
Well, with colon hydrotherapy, there's certain things you have to do after your session. So at the website, soulfulcleanse.com, I tell people to go on there. Even if you're going to another colon hydrotherapy place in New York, wherever,
right.
soulfulcleanse.com, look at the Soulful Cleanse tips. So before and after. So we say that after your session, within 12 hours, you need to put 30 billion colony formation units of probiotics into your system.
Okay.
This is important.
Okay.
So That's all it is. It's
But,
just.
but the probiotics they can get from you. They can
they get
that
it from me,
okay.
or even, and you know the deal.
Yep.
I speak health all the time, so
Yes.
people come in, I'll teach them how to shop for a good probiotic, what to look for in a good probiotic. You
Right.
know, all probiotics are, anyone can make a probiotic, so they're all different. There's certain probiotics that are powerful that can get through your stomach acids and actually work. So, but that's it. If someone has a bad experience, it's either they didn't do the proper post follow-up,
Yes.
which is included in anything, even in medical field operations, you have pre and post. Or the detox was so intense, they couldn't take it, and they thought that it was literally something bad for their body.
That's right.
Which was the total opposite. They needed it.
That is, I do want to give everybody the heads up in regards to something. According to Southwestern Medical Center, it has been hypothesized for years that a low-fiber diet that's high in animal protein and red meat can also increase colon cancer risk. And I think we talked about how a lot of younger people in their late 20s and 30s are starting to get colon cancer. They said we have no definitive evidence to support either of these theories, but patients' overall health would only benefit from consuming a healthy diet that prioritizes fruits, vegetables, and high-grain fibers. Furthermore, new studies have suggested that certain foods can negatively affect the microbiome or the bacteria population in the colon,
Yes.
which could result in a higher risk of colorectal cancer.
Yes.
Now, how does one say, listen, okay, I'm in my 20s, I'm in my 30s, I want to initially go after and do a colon hydrotherapy. I live in somewhere where they may not have them. What do you suggest that that person do in order to find a person like you? Because you're different. And I have to tell you why you're different. Audience, the reason I have started really going to Dr. Joel and sending a few people over, it's not so much that you can go into a colon hydrotherapist office. Many of them just say, okay, just use do what you need to do and leave. Dr. Joel goes a little deeper. He actually brings you in the room and you both look at what had come out of you.
Right.
And I love that because, again, there might be something in that toilet, in that basin, that may be extremely toxic or extremely dangerous. It could be dangerous down the line.
Right.
When a person is trying to find someone like you, how do they find you? See, it took me a minute to find you. And so there are going to be people who don't live anywhere near Delaware and Jersey and New York. What do you suggest they do? What websites could they go to?
I'm a big fan and a believer. And I'll give the example with an experience with my wife. She needed to find a doctor for what she's,
Yes.
the good news.
Yes.
But a big part of it is, see, what happens is, so our bodies, we have the flesh, but we're spirit beings. But yet we use Google to find a doctor.
It's true.
Use your spirit, use prayer. That's how, you know how many people come into my office that I had one girl leave me a message at like 2 in the morning. 2 in the morning. I get this all the time. I mean, I see about 100 people a week over there.
Yeah.
And a large percentage said I was just done. I was going through the whole, and so I prayed about it. So I'm going to say it straight up, pray.
Yeah.
Pray for someone.
I did.
God lead me to find someone, and it doesn't even have, and he'll lead you.
Yes.
That's serious. I know sometimes we want a cookie cutter way to find somebody, but make it a matter of prayer. Get on your knees, say, lead me to someone. There are people out there that are passionate about it. You know my deal. I'm passionate about it.
You are.
I got people who come to me. I work with everyone. I don't care what your situation is, whatever, because your healing is number one.
That is correct.
That's it. That's
right.
just bottom line. So there are people out there that are doing this. They're not doing it for financial gain. They're not doing it. No, they're doing it because it's a calling and it's a passion. So I can say myself, I'm very strong in spirit, have very strong in faith. So to connect with someone like me, you have to do the same thing.
Absolutely.
Okay.
Absolutely. That's how I found you.
Yes.
I prayed about it. I just want to go through a few things of why colon hydrotherapy is, there's some more benefits. Besides making the digestive system more effective, it maintains regularity and prevents constipation, increases energy, which has happened to me. increases the body absorption of vitamins and minerals,
Yes, that's big.
nutrients, improves concentration,
Yes.
it kickstarts weight loss, maintains pH balance in the bloodstream, improves whole well-being, a whole person's whole well-being,
Yes.
which is very interesting because that's what has happened to me as well.
Right.
I can't even explain to people how much I feel like I want to run around the block 20 times because you have so much energy because the toxins are becoming more and more few.
Right. But just real quick to interject, you went through the process.
I did.
She had some rough detox.
I had some rough detoxes, folks.
So I don't want this, when you're talking about healing with anything, with the healing, there's a journey with it.
There is.
So I tell folks that is the promise of sticking through the journey.
That's right.
And cleansing and pulling out the toxins of your colon. This is not a one-time deal where you come in and
Yes.
you will experience. A lot of people will come in and do a session and they get their bellies down for a short period of time, but I'm going to let you know that it's going to come back again because we haven't really addressed what's causing or get rid of the bacteria that's causing the bloating.
That's right.
So for everyone, and there's a lot of people out there that deal with bloating, I will tell a lot of clients, before you come in and get on the table, let's talk. I'll tell you, make some recommendations for some things for you to take so we can pull out that bacteria. And then when you come in for a session, it is almost like a rinsing.
Absolutely.
Of pulling out that bacteria. But you had a journey.
I did. I had a journey, and
And
folks,
you stuck with it.
listen, man. I listen. You couldn't tell me a
Hour
thing.
drives, yeah.
One from Jersey, Trenton, New Jersey to
Delaware.
It wasn't painful. There was a time I came up in a snowstorm. Do you remember that?
I remember that.
But I was dead serious.
Yes.
Again, this journey is about how important is this to you. It was important to me, and I can share this because this is the time where I always feel like to be transparent, people need to understand so they can relate. 2.5 years ago, I woke up one morning about to go to the gym. I was kicking off a very healthy start, and but yet still dabbling into fried foods and things of that nature because of my job, and I had a heart attack. So a lot of you are probably going to be like, oh my God, I didn't know. Well, I recovered within 3 days, which is probably a great thing. However, that was when I said enough is enough. I am not going to do this anymore. So I felt what I've been doing in my life was not working. So I had to find something total opposite. And I did. I started more of a plant-based diet, exercising, and I found Dr. Joel. But again, you're right, it was through prayer because I said I just want to be healthy because health is wealth. And so the journey was I wrote down everything that I needed to know about myself. I was getting to know myself again. And as I was writing it down, my pressure, my this, what I'm feeling, I was detoxing. It was rough, but I stuck to it because I knew the end result would have been saving my life. And so that's where I really want folks to understand how important it is that Paris Hair and Beauty Supplies brought Dr. Joel here. We've sent countless amount of people to Dr. Joel, and because of what they've witnessed with me, and I definitely always want to share the good things of what I'm going through with others because that's what we as a community need to do. Now, I wanted to also dispel the myth as far as men. Men tend to feel that it's not natural for them to do a colon cleanse as they're not comfortable with anything near their anus. So, what do you tell men about this process?
That is something that I deal with every day, and I talk to a lot of men. First of all, we have a colon, just like women.
That's right.
And our colon gets compacted with waste matter. And the type of setup that we have, you're familiar with it, it's non-invasive. The actual speculum is what they actually call it, that you're only inserting a small portion into the rectum.
Right.
It's not painful, it's comfortable. So when guys come in, a lot of times they either come in because they've researched it and they're desperate and they want to change their health, which is great.
Right, yeah.
The rougher ones are the ones that are dragged in by their wives.
I've seen it.
Yes, but it all happens the same with all of them. once they get through the first couple of minutes, they understand it's not a big deal,
Right.
and then they see what's releasing out of them,
Yeah.
they're in. They're in. So it's just the fact that this is not something that is painful. It's not something that is going to change your lifestyle in
Right,
any way.
right.
You realize that there are some things that we have to do to drastically for our health. And but we got a lot of guys. I will probably say that my client base now is probably up to about 20% men now, which is amazing.
Well, I was there.
at like 5% one time.
I when I came in, I was very surprised, and some
Yeah.
of them were with their wives, and they were doing it along with their wives at the
Yes.
same time.
Yes, it's
so
powerful.
that is very, very good to
Yeah.
know that, as particularly, and I'm saying particularly, people of color. There was a time that colon cleansing, I heard it being talked about in the European community. Like my folks that I would work with, you would never hear African Americans say, "Oh, I'm going to do colon hydrotherapy." It's somewhat like new for many of
Right.
us, which is pretty sad.
Right.
But my husband even did it. Yes, Paris hair abuse. My husband did it. It was a journey for him. He was like, I don't know, but he did. And I think what also helped was that you are a man.
Yes, to
you
talk
as
to
well.
men.
Yes.
And I talk to them, and when they get in the room, I talk to them, make them feel comfortable, let
Yeah.
them know.
Yeah.
Listen, man, let's focus on why you're doing this.
That's right.
Let's focus on why you're doing this. And then when everyone says the same thing, man, that wasn't that bad.
Right.
That was really good. Or they
Right.
come out and it's always a positive. I've never had a man come out and say, man, that really,
That was the worst.
abuse. no, not at
I feel
all.
violated.
Not at all. And the good thing is I can come from a male perspective when I explain to them how to get on the table.
Yes.
I tell them what I do.
Yes.
As a man, this is what I do. And I also let them know, listen, man, while you're getting it done, I'm on my phone, I'm looking at ESPN and all
yeah.
that good stuff. It's not that type of situation. And so,
And folks, it's not, and just to even go further on that, it is a very comfortable spa type environment.
right.
It is not like going to the hospital, like the gynecologist ladies, and your legs. It's not like that, where you feel invaded. It is a very
Never
serene.
exposed.
Never. Ever.
No one's ever
Ever.
exposed.
It is so
Yep.
comfortable, and so that's what I also really loved,
Right.
particularly about your place in general. Let's play true or false.
Okay.
All right. Coffee enemas are better than water cleaning.
False.
Why do you say that?
The best cleanser in the world is water. There's nothing better than water. Water is pure.
Yes.
The farther you get away from it, the less effective it is. Coffee enemas are great. They're effective, but they don't come close to the power of water. So if I said to you, listen, I need you to flush your system with this glass of water, or I said, I need you to flush your system with this hot cup of coffee,
Right.
what would you think?
I would go with the water, of course.
Okay.
Yes. And I will tell you guys, on social media, and I always want to ask you, I wanted to ask you that because I wanted to ask a professional opinion. On social media, you'll see this all the time. People are like, oh, do the coffee cleanse, do this cleanse. Stop listening to social media,
Yeah,
please.
definitely.
Do us a please. When it comes to anything that is to go up in you, you need to be very, very careful. And the first thing I thought was coffee. Well, doesn't coffee leave a residue? I mean, I don't understand why would anyone do that. But in fact, the fact is coffee sometimes used in colon cleansing have been linked to several deaths, people. Be very, very careful. It is not reported as such, but there have been deaths linked to it because of the amount of toxins it created in the system.
Can't go wrong with pure water.
You cannot
That's what
go
I say.
wrong.
I don't treat my water. My water is purified.
Right.
We have 3 filtration systems. I don't add herbs to it. I know some places do. Pure water.
Yeah, yeah.
Pure water.
I love it. I love it. Colon cleansing increases fertility.
True.
All right, let's talk about it. Some
True.
of you guys want babies,
So-
you're having a hard time. All right.
Yeah, so, fungus.
Okay,
This is the deal.
okay.
So with women, and I see it every day, women produce a lot of fungus, also known as Candida
Yes.
albicans.
Okay.
Candida attacks the female reproductive system. Candida starts in the colon. It starts in the intestines. When a candida comes out through a yeast infection vaginally, that's an expression. It starts in the colon.
Gotcha.
It can come out on the tongue. That's called oral thrush. That's an expression. It can come out on the skin. That's an expression. Starts in the gut. A lot of women will come in. Now, keep in mind, forget the location of the colon in your female reproductive system. It's all together down there. Everything is all together. So that's a big deal. We've heard of leaky gut. So now you have bacteria seeping, and the first thing it passes by is the female reproductive system, or for men, the prostate, because it's all in that area.
Right.
So when we get rid of that fungus out of the bowels, oh man, it changes the female reproductive system and the endocrine system. A lot of people think when they hear of candida or yeast, that, well, I don't have yeast because I haven't had a yeast infection in years. It's in the gut and it lays dormant. I know what it looks like when it comes out.
Right.
When it's darker in color, it's old yeast. When it's white, which is albino, when it's white, it's new yeast. So I can tell a person, hey, you have an active yeast infection going on right now, and they say, yes, I do, because you can tell by the color of it. It all looks the same, and it floats to the top of the water, so you can see it. But yes, that is the most powerful thing with the female reproductive fertility. It's all back to bacteria. It's bacteria. You got to address the bacteria. Yes. So
and that's going to be, that's very interesting. And it is a fact. It is a fact. Colon cleansing, as well as increased fiber intake and healthy food choices, improves regularity and helps keep your weight under control. Fat is estrogen based, and if too much is present, becoming pregnant becomes more difficult. A colon that is weighed down by years of buildup can also press on the uterus and surrounding reproductive organs in women, causing strain. Colon cleansing rids the body of many chemicals and toxins that affect the egg and sperm. Many naturopaths recommend that both partners undergo colon cleansing before attempting pregnancy.
Get the bacteria out of the way.
Get the bacteria out.
Get the bacteria out. I'm glad that they said that. Couples, when they do, I have a couple right now. They're coming literally every Saturday. And we're cleaning them. We have them on a detox. They've had some issues. Of course, they've been through the whole deal with the doctors and shots and all the uncomfortability. So we're getting back to the basics of, naturally taking care of them. But doing it together, that's extremely, extremely important.
That is very, very good. And so, folks, for those who would like to schedule sessions with Dr. Joel, please tell them where you are located and how can they reach you.
So the best is soulfulcleanse.com. It's spelled just how it sounds. SOULFUL cleanse, CLEANSE.com. Go to soulfulcleanse.com. You can call the number, set it up, and then when you come in, be ready for the experience. It is going to be an experience.
And a great experience at that. It's
a
great experience, and I really appreciate you taking the time to speak with us about colon hydrotherapy, because again, we want to dispel the myths. We have people who come in and say, okay, Donna, how did you do it? What did you do? How do I get rid of the weight? How do I get rid of this, the eczema, and so many other issues that folks are coming up to you? And so it's good to hear. The one thing that I do want to express to folks, because I do know that there are a lot of people coming in with a lot of issues pertaining to their health. And one of them, I think you had an experience with a young lady who initially had eczema, severe eczema on the legs. And I really wanted to let you know, I really appreciate how well you've taken care of a lot of your patients. And that is one of the reasons why I suggest people go to Dr. Joel, is because he takes the time to explain situations and why it happens and where it stems from. So I wanted to thank you for that.
No problem.
All right, folks. So thank you so much for joining Paris here with Dr. Joel Williams of Soulful Cleanse. We look forward to seeing you here again, and we bid you good night.
Thank you.
All right, folks, we are here with our session of Q&A with Dr. Joel Williams of Soulful Cleanse, and we are here with Ms. Aza. All right, Aza, please state your question.
Well, I have this cough that has been going on for literally decades. And I've gone through pathology. I've gone through colonics some time ago, a series of it. I've done Ayurveda for like 3 weeks, and yet I still have a cough.
Lingers.
I've looked at my diet in terms of ridding myself of dairy. I eat little to no meat. I'm just not sure what to do about it. And again, it's been decades.
Okay. Well, so someone like you will come to the office. First thing is, once you finish your session, again, we're looking at your release. So there's a couple of things I'm looking at with you when you explain what you're dealing with. I'm looking at your acid levels. That's the first thing, because I need to know if your acid levels are causing this constant cough. Now, what happens, our acid levels, our pH levels, they fluctuate throughout the day. So when you do a pH test or you pee on it, that will not give an accurate deal of what's going on. Now, when you do a cleanse, whatever's coming out of that stomach and the colon, I will be able to see it. The second thing is addressing if it's something that is structural. So sometimes what happens with people is some type of trauma, car accident, something happened back in the day. At that time, caused the spine. So then I'll, in conjunction with everything, we'll create a protocol where we'll connect you with a chiropractor to do adjustments, because it could be something that something's out of line. So we'll accomplish it all. I'm not the Walmart of healing. So we put together, we have a nice crew of people that I can say, okay, go over here, get a couple of chiropractic adjustments. You might need just one to line everything up, determine what is going on with your bronchioles, because your bronchioles is one of your five eliminative organs, and that's what we specialize in elimination. So your bronchioles and your lungs are extremely important. Could be inflammation. We'll see that in the bowels.
Totally.
So that's how we would do it. It's not just get on the table and try Ayurvedic medicine. I have experience. I love Ayurvedic medicine. I'm taking something now today. I love Chinese traditional medicine. I love homeopathy. I love enzymes. But like I said, everyone is different. So I don't lean towards one specific type of healing modality. It's putting together something that covers you with water, food, detoxing, structural, the whole deal. Okay?
Great.
Does that answer your question?
Yes, in fact, because you pulled all those pieces in rather than just colonics.
Yeah, no.
Because I have gone, because of the cough, to chiropractic, thinking, maybe something's going on.
Maybe structural,
over
right.
the lungs. So everything that you spoke of in terms of the package, for me, makes sense.
And when are you coughing? Are you coughing a certain time of day? Is it at night or is it throughout the day?
Day, night, winter, spring, summer,
Wow.
fall, weeks at a time. Long time.
Yeah.
Sometimes
It's interesting,
harsh that it makes me,
and that happens with a lot of people. And so, with that, disease has a path, and that's what happens, man. Our bodies get into these grooves, and your body is in a groove right
Yes,
now.
I believe
So what we have to do, shut that road down, create a new path. So this is the path your body's going down now with this constant cough. So what we do is find out, and there's a combination of, like I said, there's the physical in defining out, looking at it. There's the spiritual in defining out as well.
Yes, and I heard you
I don't know all the answers.
mention that.
Yeah, but your creator knows the answers.
Yes.
That's right.
So we can tap into them. Thank God. He's
Yes.
created a way for us to tap into them.
Yes.
So this is a combination right here. And
Absolutely.
that's what's missing in the medical field. There was
absolutely.
we always talk about there's
Yeah,
a
we do.
time when hospitals were run, a priest would be at the head of a hospital praying over everyone in there. Now it's shifted. Now it's so just in and out and
Right.
scientific proven. So I think that combined approach will get you to where you have to go.
Yeah.
And on a spiritual note, I know it to be so because I asked for help just a few days before I came into the store.
Good.
Wow.
And hung out literally.
Wow.
Good.
And found out that you were here.
Coming. All right,
You know,
good. And you came and you
and
showed
you
up.
And I've been out busy, and I said, I gotta go though. I gotta go.
Yeah, good.
And can I just say something real quick? I don't have a car, and I deal with public transportation, and I had some business to take care of today. Went to the bank, and the bank was literally closed. And this man showed up, and he said, I'll take you to the bank on Princeton Avenue. And then he took me to the bank, and I needed to go to the store. And he said, I'll take you to ShopRite. I'll wait for you and take you to ShopRite.
Yeah, that's amazing.
And then on my way home, the
about.
bus showed up to take me downtown to finish part 2 of my business day. And I was able to get here, drink some water, drop my bags, and arrive. So.
Good.
That is fantastic. Good. He will always answer you. Trust me, I've been there.
Definitely.
Wonderful. Thank you so much.
And I'm moving to Philadelphia, but you're in Delaware, so I'll
Yes, yes, he is.
All right, thank you.
We're trying to get him to Trenton.
Okay.
We're talking about it.
Alrighty.
All right. All right, you're all set. Please state your name and what is your question?
Zanetta, and I'm asking 2 questions because somebody was afraid to come up here and ask. So I'll ask her a question first.
Okay.
She wanted to know about how does it affect imbalance hormones or hormone imbalancing.
Okay. Well, we kind of talked a little bit about the bacteria and how bacteria works like a computer virus. It goes after certain systems. So the main bacteria or the fungus that goes after the female reproductive system or the endocrine system is fungus. So it will wreak havoc. Bacteria will literally wreak havoc on your hormonal system, have it up and down, up and down. This is why a part of hormonal imbalance has to do with things connected with food, cravings. So we're right back down to the digestive system. So bacteria, food, fecal matter, toxins, it's all connected. You just have to address that first. Now, what I do with clients, I have a lot of people that come in and they have PCOS, they haven't gotten their period in years, they're irregular, all these different issues. First thing, you have to detoxify properly. You have to clean house. Then we'll give them things. People know of all the herbs, black cohosh, all the powerful herbs, but what's happening is they're trying to take them and they're putting them into a toxic environment because they haven't properly cleansed and pulled everything out. So that's the first step. Clean out, detoxify the body, then fortify the system with some of these powerful herbs and nutrients out there that your body will receive now because you've cleared out the foundation. Okay, and your question?
Donna's a client of mine.
Okay.
And I've seen the change in Donna from the time that we started to now. And she's always amazed me from the time I walked through the door until now.
You're so kind.
So she's my inspiration. I'm talking about me now as far as what's going on with me. I have fibroids. Okay. So I am very adamant about not getting surgery.
Yeah.
But I need to do something because they're affecting everything. I had even asked a question to a friend jokingly and saying, oh, this is all just my fibroids that are going on. And she was like, it's not your fibroids, you're fat. But,
really?
Take it in and you say, okay. But I'm a little bit apprehensive about doing too much because I don't know what's going on there. They want to do, what's the surgery? They don't want to do a hysterectomy, but they don't want to do an ablation. They actually just want to go in with the robotics and do a little work in there. But I'm still, I'm not there. But I want to know if something like the hydrotherapy can help somebody like me when it comes to the fibroids.
Well, definitely in addition with, we would need to be on some type of program. Well, once again, colon hydrotherapy is an effective part of a healing program. It has to be connected with water, food, supplements, and colon hydrotherapy is right there in the mix with it. My experience with fibroids, we work with a lot of my clients that have had it before, and a couple of things. You have to obviously balance the hormones. High estrogen levels play a role in it. I've had success with breaking down fibroids by putting a woman on a testosterone supplement for men. So but once again, we have to get to know you. And yes, weight. Your weight is extremely important. I had one lady, she dropped like 60 pounds and her fibroids were gone. Now I have some women that come in there and they're underweight and they have fibroids. And so fibroids are there for different reasons, and we just need to find out why and then go right after it. Once again, detox, then go after it.
Yes.
And then things will be effective. The way that happens is, I believe, the way that the practitioner, the healer, and the client, and you know this as well, you have to have a relationship.
Yeah.
You have to know what's going on. I have people that have fibroids because of a traumatic experience in life, sexual abuse when they were a child. And it's reacting, that's how it's expressing itself now. And they haven't gotten counseling over it. So there's so many different avenues with it, but that's a part of getting to know the client, and that's the new, what they call functional medicine, where that's how it works. Relationship, finding out what's going on. There's so many answers. The internet will really mess people up because it's everyone's story that worked for them, and now it's supposed to be, you know, the cure-all for everyone.
Right.
No, you're specific. Your fibers are there for a reason.
Yes.
They're not dissolving, and there's a reason
There's
for
a
that.
reason, yeah.
We need to find out what that is.
Absolutely. And just to share, because I too was going through that, like 5 years ago, folks, I had to literally use 3 pads at one time. Like, I mean, it was just too much because of the fibroids. When I changed into a plant-based diet, it's very important for folks to understand this. Your lifestyle, I don't like diet, your lifestyle change has got to be so, you got to be determined to change that part of you. You're going to see your body shift, whereas now, not a problem, nothing whatsoever. And when they did the test on me 5 years ago to look at where the fibroids, they were everywhere. I mean, I felt like I had gazillions of them. They did the test earlier this year, barely any. Where did they go? I don't know. I couldn't care less. What I'm concerned about is, wow, this whole program that I'm on, this journey that I'm on, actually helped to heal my body. So you have to find what's going to heal yours. Because again, I share my journey, but I always, what do I say on social media? This is my journey. This has to be yours, and you have to take into accountability like I did. I found Dr. Joel, I did the lifestyle change, and I really went in. That's something that you would have to do as well, if that helps. All right. Thank you. Wonderful.
All right.
All right, well, that I think that concludes our Q&A with Dr. Joel Williams. You did a fantastic job, my brother. All right, wonderful. Well, we look forward to seeing you next time here at Paris Hair, and we will say good night.
All right, goodbye.
In silence about the atrocities of our hair. Put together business model and pray that every customer receives full care. Packed our bags and said sail toward Trenton to build a store we didn't quite understand. 'Cause I love